There are two FDA-approved GLP-1 pills on the market right now, both for weight loss, both daily, both work on the same receptor in your brain, and they are not the same drug. One produces a little more weight loss, but demands a strict morning ritual, empty stomach, a few sips of water, wait 30 minutes every single day. The other one, take it whenever, with coffee, food, with whatever you want, no rules. Patients on Reddit are calling them the strict pill and the easy pill, and the shorthand actually fits. Today, I'll tell you what these two pills really are, who each one is built for, and the trade-off you are actually making when you pick one. I'm Dr. Clete Barrick, dual board certified in internal medicine and obesity medicine. I've treated thousands of patients on GLP-1 medications, peptides, and medical weight loss therapy. This is Straight Shot, the science of weight loss explained by a doctor who lives it. Quick note, everything on this show is for education only. It is not medical advice for your specific situation. Always talk to your prescribing physician before making any changes to your treatment. Welcome to Straight Shot. Here is where we are in May 2026. Oral Wegovy launched in December. Within the first week, it was prescribed over 18,000 times, a stronger debut than the injectable got back in 2021. Foundayo, the brand name for orforglipron from Eli Lilly, got FDA approved in April of this year. So this is a brand new. The first time in history a patient walks into my office and says, I want a GLP-1 pill, and I actually have some real choices to make. The marketing makes these two drugs look interchangeable. Both pills, both daily, both for weight loss. They are not interchangeable. Different molecules, different absorption, different rules, different efficacy, side effect profiles, same target, everything else, a fork in the road. And I see patients picking based on the wrong things. Their friends, is on it. They saw a TikTok. Their primary care doctor had a sample. That's not how to pick. The right pill for you depends on one question, really. What does your daily life actually look like? Because the lived experience of taking these is so different that the molecule almost stops being the point. Adherence is the point. 5 shots, chemistry, dosing, weight loss, side effects, cost. Then I'll tell you exactly which pill I write for which patient. Shot 1, the chemistry. Foundayo and oral Wegovy are not just different brand names, they are different kinds of drugs. Oral Wegovy is semaglutide, a peptide, so that's a chain of amino acids that mimics your natural GLP-1 hormone. Peptides have one big problem: stomach acid destroys them. An enzyme called pepsin tears them apart on contact. That is why every GLP-1 for the last 20 years has been an injection. So how did Novo Nordisk make a pill version? Well, they paired it with an absorption enhancer called SNAC. SNAC buffers the pH around the pill, so the acid doesn't destroy the drug. It keeps the semaglutide molecules from clumping, and it temporarily makes the cells of your stomach lining permeable so the drug can slip through into the bloodstream. Even with all that engineering, bioavailability is only about 0.8%. About 1 in 125 molecules you swallow makes it into your blood. The 25 milligram tablet ends up producing blood levels comparable to a 0.5 to 1 milligram subcutaneous injection. Once it's in your blood, it acts identically to the shot. Foundayo is a completely different story. Orforglipron is not a peptide, so it's a small molecule, a different category of compound entirely. It's designed from scratch to bind the GLP-1 receptor. Because it's not a peptide, stomach acid doesn't destroy it. No SNAC needed, no absorption enhancer, no food restrictions or water restrictions or timing windows. Per the FDA label, you can swallow Foundayo any time of day with or without food, with whatever beverage you prefer. It is the first small molecule GLP-1 receptor agonist ever approved. So 2 pills, same target, 2 completely different keys, and the chemistry is what determines everything that comes next. Shot 2, the dosing rules. So both medications use a slow titration ladder. That part is roughly the same. Foundayo first, so 6 dose strengths from 0.8 milligrams up to a max dose of 17.2. Step up is monthly, so the ritual, take it any time of day with food, without, etc. Swallow it whole, don't split or crush it. That is literally the entire instruction set. Now for oral Wegovy, 5 dose strengths from 1.5 up to 25 milligram maintenance dose, same monthly titration. Here's what patients on Reddit have nicknamed the Wegovy ritual. And listen carefully because every piece of it does matter. 1, take it first thing in the morning, completely empty stomach. 2, with no more than 4 ounces, about half a cup of plain water, not coffee, not juice, plain water. 3, wait at least 30 minutes before eating, drinking anything else, or taking any other oral medications. 4, swallow whole every single day. And patients ask me, come on, is it really that strict? And the answer is yes. The data is not subtle. So take it with food. Drug absorption is severely reduced or actually completely absent. Wash it down with a glass of water. You get about 70% less drug exposure than with 2 ounces. So skip the 30-minute wait. You cut into your absorption window before the tablet has even finished eroding. Skip the ritual and the medication does not work. That is not a best practice. That is the difference between absorbing the drug and not absorbing it at all. The chemistry built the ritual, and the ritual is what every patient has to live with every day for as long as they're on the drug. Shot 3, weight loss data. So how much weight comes off? Both drugs had phase 3 trials in the New England Journal of Medicine in 2025. Different studies, different populations. There is no head-to-head, so the comparison is imperfect. But the headline numbers are clear. Attain-1 was the Foundayo trial. 3,127 adults with obesity, no diabetes. They were treated for 72 weeks. At the highest dose, 17.2 milligrams, patients lost 12.4% of body weight. It's about 27 pounds. Now, mid-dose, around 10.8%. Low dose, 7.5%. Placebo, less than 1%. The DEXA body comp data showed about 73% of the weight loss was fat mass and 27% was lean. So right in line with the rest of the GLP-1 class. OASIS 4 was the oral Wegovy trial. That was smaller, 307 adults treated for 64 weeks. At the end, patients on the pill lost 13.6% of body weight. Placebo lost 2.2%. 30% of the treatment group lost 20% or more. And here's the part I want you to hear. 13.6% is comparable to what injectable Wegovy 2.4 milligrams produced in the original Step 1 trial. So same molecule, same mechanism, similar result. The pill is the injection, just slower and harder to take correctly. Stack them head to head. Oral Wegovy, 13.6% at 64 weeks. Foundayo, 12.4% at 72 weeks. So a 1.2 percent point gap. That's roughly 3 to 4 pounds of difference for a typical patient spread across more than a year. The gap is small enough that adherence probably matters as much as the molecule. A patient who takes oral Wegovy correctly 6 days a week and breaks the ritual on the 7th isn't getting 13.6%. They're getting whatever absorption their actual habits allow. A patient who takes Foundayo every day with breakfast, no thinking required, gets the full 12.4. The trial number is the ceiling. The ritual is what determines whether you actually get there. Shot 4, the side effect paradox. So both drugs activate the same receptor. So both produce the same family of gastrointestinal side effects: nausea, vomiting, diarrhea, constipation, dyspepsia. Most cluster during dose escalation and plateau once you reach a stable dose. And critically, GI side effects are not the mechanism of weight loss. Patients who get sick and patients who do not lose essentially the same amount of weight. So feeling terrible is not why these drugs work. There is a stubborn myth out there that you have to suffer for these to work, and that's just wrong. And now here's the paradox. Nausea. Foundayo, at the top dose, 33.7%. Oral Wegovy, 25, 46.6%. Vomiting. Foundayo, 24%. Oral Wegovy, 30.9%. So by that math, Foundayo looks easier on the gut. But discontinuation rate, the number of patients who stopped because of side effects. Foundayo at the top dose, 10.3%. Oral Wegovy, 25, 6.9%. So more Foundayo patients quit. How? Foundayo's GI side effects are steeply dose dependent. At the lowest trial dose, nausea was around 29% and discontinuation was about 5%, much gentler. In real-world practice, a lot of patients aren't going to need the max 17.2 milligram dose, and plenty land in the 5.5 to 9 milligram range and stay there because that's where they're losing weight. That's the golden rule. Like it always does, it works on these meds. The dose that works is the right dose. There is no medal for getting to the top of the ladder if you don't need to. Oral Wegovy doesn't have that gradient. The 25 milligram maintenance dose is where you're probably going to live. The 46.6% nausea figure is the realistic expectation, not a worst case. So here's the honest framing. Oral Wegovy is harder on the gut, more consistently, for the duration of treatment. Foundayo can be harder at the very top dose, but a lot of patients don't need to go there. If you like this depth of coverage on GLP-1s, head to barrickhealth.com and pre-order the GLP-1 Bible. It's the most comprehensive book on GLP-1s and weight loss ever written. Release date is just a few weeks away. Lock in the pre-order price now. Back to the episode. Shot 5, what'll you pay? Cost used to be the easy differentiator, but not anymore. Both manufacturers have leaned hard into direct-to-consumer pricing. As of mid-2026, self-pay through the manufacturer pharmacies is the rational default for most patients without strong insurance. And let's be honest, that's most of us. Foundayo through Lilly Direct, starting dose is $149 a month, step 2, $199, and then from 5.5 milligrams up to that max 17.2 is going to run you $299 a month. With commercial insurance and the Lilly Savings Card, eligible patients can get as low as $25 a month. Oral Wegovy through NovaCare, starting dose $149, so same as Foundayo. Same trajectory through titration. So maintenance dose is $299 a month with commercial insurance and the savings card. Eligible patients dropping down to about $25 per month. So cost is no longer a meaningful differentiator between these two pills. Both walk you from $149 to $299. Both can hit $25 with good insurance and a savings card. The decision is about how the medication fits your life, not what it costs. Here's the straight shot. This is what I tell my patients. Foundayo trades a little bit of efficacy for convenience. Oral Wegovy trades that convenience for a little more efficacy. Neither is universally better. The right one depends on what you can actually do every single day. Pick Oral Wegovy if you can build the morning ritual into your life reliably. Wake up, swallow, set up a 30-minute timer, do your morning routine while you wait. So if that sounds doable, you're a great candidate. Pick it if you want max weight loss from a pill. And pick it if you have true needle phobia and injectable is genuinely off the table. That is the number one reason I write Oral Wegovy. Not patients who prefer a pill, patients who cannot use a needle. Big difference. Pick Foundayo if the morning fasting window genuinely will not work in your life. Shift workers, parents with kids who eat breakfast at 5 a.m., frequent travelers, patients on levothyroxine for thyroid, patients who need that coffee in their hand the second their feet hit the floor. That's me for sure. Pick it if you're switching off an injectable for low friction maintenance. And one important reframe. If you can already tolerate injections and you want max weight loss, neither pill is your best option. Tirzepatide injection still produces around 20% weight loss. That's from the SURMOUNT trials. The oral pill conversion, is for patients who cannot or will not inject. Do not pick a pill just because it's a pill if a needle, would actually serve you better. The right pill is the one you'll actually take every day the way it's meant to be taken. That's not a hedge. That's the entire decision. That's your side-by-side. Foundayo, the easy pill, around 12% weight loss, no rules. Oral Wegovy, the strict pill, around 14%, build the ritual. If you got value out of this, share it with someone who's trying to decide. There's a lot of bad takes online from which pill is quote-unquote better. The honest answer is neither until you know which one fits your life the way you actually live. Want a doctor with the time to walk you through this one-on-one? That's what I built at Barrick Health. Visit barrickhealth.com and set up a free consult. I'm Dr. Clete Barrick. This was Straight Shot. We'll catch you again soon.